Hello everyone, how are you all? Welcome back to another interesting video of a valuable skill for personal and professional development from Nurses, the Heart of Healthcare. Keep learning, keep growing. My name is Shehnaz, and in this video we are going to learn a life-saving skill that everyone should possess, irrespective of you're from a medical background or a non-medical background, because it can make a significant difference in case of emergencies. And the name of this skill is BLS, that is Basic Life Support. Let's all of us empower ourselves with the sound knowledge and skill to effectively respond in life-threatening situations like cardiopulmonary arrest by learning the skill of BLS. It is a life-saving skill, and the process of entire BLS involves recognizing and responding the emergency situations, okay, like cardiac arrest or heart attack or foreign body airway obstruction, in order to maintain the airway and to support breathing and circulation till the medical aid arrives. Okay, so it is a very important skill that everyone must learn, very interesting, and not just because it can save a life. Guys, it's not just about saving a life. Okay, when you learn the art or the skill of BLS, then it gives you an immense peace of mind, satisfaction and happiness that you can save a life. Okay, you can save a life. So let's all of us refresh the skill of BLS in this video. Okay, but before moving ahead, a small reminder that if you are new to my channel, please subscribe my channel, and if you find the videos helpful, please do like and share my videos. What is BLS? BLS stands for Basic Life Support. I myself came across this question many a times during my interviews and exams. It's a very important topic, okay, and we all must be aware of it. BLS skills are specially required for first aid providers, for paramedics, for firefighters, and for the hospital staff, especially for the nurses and the doctors, and even for the other people. Okay, so it's a very important. This video is not only for the medical professionals but also for the non-medical. So let's get started. What is BLS? BLS stands for Basic Life Support. It is a type of medical care that is provided by the emergency medical team and healthcare professionals to the person who is experiencing cardiopulmonary arrest, okay, cardiac arrest or the respiratory arrest, okay, and even in case of choking or drowning, okay, that is airway obstruction, we also use BLS. Okay, so it's a very important skill with the help of which you can immediately respond to this emergency situation and save the life of a person. It increases the survival rate in case of cardiac arrest, okay, and it reduces the risk of severe brain damage. So it's a very important skill. The main objective of BLS is to provide oxygen to the heart and brain, the most vital organs. Yes, because the heart stops breathing, the circulation stops. So the main objective of BLS is to keep the blood circulating in the body, okay, to sustain the tissue viability until the definitive medical aid arrives. Okay, but it is very important to understand that BLS is not to treat the person. We are not treating the person who is in cardiac arrest or respiratory arrest. It is just to buy some valuable time until the emergency medical aid arrives. Okay, but without this BLS skill, without the immediate and appropriate attention, the victims of cardiac arrest or the respiratory arrest or the people with obstructed airways, they can lose their life. So it is very important, rather than thinking and wasting the time, it is very important that we act. Okay, so BLS is all about what you will learn in BLS is how to recognize the emergency situation, recognizing the emergency situation, doing the initial assessment, okay, then skills to relieve the airway obstruction, skills to perform CPR, and skills to use AED, that is automated external defibrillator. So this is what is all about ELS. Let's learn in briefly about it. Now coming to the steps of BLS, okay, there are many things that we learn every day, right, in medical field, and to help us to remember it easily, what we can do is we can form a mnemonic. Yes, so in the same way for the BLS steps also there is a mnemonic If you remember this pattern of letters, we can easily remember the steps of BLS in order. Okay, that is doctors A, B, C, D. DRS A, B, C, D, where D stands for danger, R for response, S for send for help, A for airway, B for breathing, C for circulation or the CPR, and D for defibrillation. Okay, so doctors A, B, C, D is the steps for BLS. So let's learn each one of it briefly. Now first is D. D for danger. Danger what? D for danger, that is ensuring the scene safety. Ensuring the scene safety is the first step of BLS. We find a person collapsed, okay, and want to help, we'll run for the help. But first thing that we have to make sure is that we have to check around for the danger for ourselves and for the others to ensure that the area is safe for everyone. Okay, because ensuring the safety of the rescuer and bystander and the victim is very important. Okay, your safety is also important. So that's the reason scene safety is the first step of BLS, because the person who is collapsed may be around some electrical wires or water, or there might be traffic there, okay, or some dangerous gases or harmful chemicals. So that's the reason we have to make sure that the person or the victim is away from all this, and you yourself have to also protect from all this kind of dangers. Okay, so we can take the person aside if the person is in the middle of the road or surrounding these dangerous chemicals or electrical wires. Okay, so we can take the person aside, not too much far and waste time, but a little aside, so that we can move ahead with the other steps of BLS. So the first step is keep calm and make sure that the scene is safe. We should not get panic. Keep calm and make sure that the scene is safe. The next step of BLS is R for response. Okay, so you have to check for the victim's or the patient's response. Okay, whether the patient is conscious, semi-conscious, unconscious, it's very important to know, right, whether they are responding to our touch and talk. So to check for the response, we have to use talk and touch technique. Okay, we have to call out the person, okay, and touch their shoulders gently. Okay, tap on the shoulders gently, and we can call, sir, are you okay? Ma'am, are you okay? Sir, please open your eyes. Ma'am, please open your eyes. Okay, something like this. We can use some simple sentences to call them out, and tap on their shoulders or gently touch the shoulders to check for the response. If the patient responds and say, yeah, I'm okay, I'm fine, I just got some lightheadedness, giddiness, something like that. Okay, the person responds and sits back. Okay, then you can check for other injuries and help the person accordingly. Okay, but if the person does not respond, then the next step is immediately you have to call for the help. Okay, the next step is immediately you will call for the help. That is S for send help. You can call an ambulance or call any medical aid person to help you. Okay, if you are alone, you have to do it yourself. But if there are some bystanders nearby you, then you can call them for help. Instead of standing and watching and making a video of the scene, they can call the ambulance, and then you can move ahead with the next step of the BLS. Okay, so you will check for the response. If the patient is responding, you will check for the other injuries and help the person accordingly. If the patient is not responding, then you will call for the help, call an ambulance, and then move ahead with the next step. And the next step is to open the airway. Okay, to open the airway. A for airway. To open the airway. So to open the airway, there are two maneuvers. One is head tilt chin lift method, and the other one is jaw thrust method. Okay, when there is no suspected cervical injury, we'll go for head tilt chin lift method. Okay, wherein how we are going to do this, we'll learn it in detail in the next video in airway management. Okay, but here we are doing it briefly. So if the person is having any suspected spinal injury or cervical injury, then we will go for jaw thrust method. Okay, once the airway is opened, then you will see for if there is any obstruction that is visible, okay, and within your reach, okay, maybe the person's own denture or any solid food particle, then with the help of finger swipe method, okay, if there is no risk that you will move it further down, you can remove it with the finger swipe method. Okay, and then next you have to check for the breathing. How you will check for the breathing? By the technique look, listen and feel. What you will look for, as you can see here in the picture, you will look for the chest movement, okay, and you will listen for the breath sounds, and you will feel for the expired air on your cheek, okay, on your face. Fine, this is how you will check for the person's breathing. Actually, pulse and breathing we have to check simultaneously for not more than 10 seconds. Okay, all this assessment should finish within 10 seconds, because each and every second, each and every minute is important in case of cardiopulmonary arrest. Okay, because the vital organs are lacking oxygen and glucose. So within 10 seconds you have to finish this assessment. So what you can do is you can keep your 2 fingers to feel for the pulse. In case of adults, we'll go for the central pulses, like we'll check for the carotid pulse, and in pediatrics we'll check for brachial pulse. Okay, so pulse and breathing you can check simultaneously. Fine, pulse you have to keep 2 fingers on the carotid artery and check it. Okay, and for the breathing you have to go for look, listen and feel technique, as you can see here in the picture. If the person is breathing, then you will put the person in recovery position. Okay, and if the person is not breathing, then you will check for the pulse simultaneously, right? So the person is not responding, there's no pulse, no respiration, then the next step is immediately you will start CPR, that is cardiopulmonary resuscitation. C stands for cardiopulmonary resuscitation. So how to perform CPR, this all of us know, right? Okay, so it is the ratio of 30:2 compressions. Okay, this is how we are going to place our hands on the person, okay, in the middle of the chest, that is on the lower third of the sternum. Okay, and we'll interlock our fingers. Okay, position the hand, arm vertically and straight on the person's chest, and perform CPR, that is cardiopulmonary resuscitation. So it is 30:2 compressions, 30 compressions, 2 rescue breaths. Okay, in adults we are using 2 hands, for kids we are using 1 hand, and in case of babies, okay, infants, we use only 2 fingers, okay, 2 thumbs to give CPR. Okay, and we have to give 5 cycles. Fine, repeat 5 cycles, and if the person is able to move or able to breathe, then normally then we can stop and check for go for the other assessment, but otherwise we should not interrupt the resuscitation. We have to continue CPR till the medical aid arrives. So this is how we are placing our hands on the person's chest. Okay, this is how we interlock and place the hands in the middle of the chest, and the depth is 5 centimeters, as we all know. Okay, 5 centimeters is the depth, and the compression ventilation ratio is 30:2 in case of adults. Then the next step is D, that stands for defibrillation. Okay, the use of defibrillator. Okay, so we'll continue the CPR until the AED arrives, that is automated external defibrillator, and once the AED arrives or is available nearby, then you will connect the paddles. Okay, so AED, in that you will have pre-recorded instructions how to use it. Okay, and you just have to follow the instructions. So once it arrives, you have to place the paddles on the person's chest, okay, as it is shown, and then the AED will assess the AED, it assesses the rhythm, okay, the heart rhythm, and if it says the rhythm is shockable, then you will deliver the shock, and if it says no, the rhythm is non-shockable, then we have to continue the CPR. Okay, so again after every 2 minutes you have to check for the pulse and respiration. Okay, if there is no pulse and respiration, you will still continue the CPR until the medical aid arrives. So these are the steps of BLS. This is how we place the paddles on the person's chest of AED. Okay, so and it has all pre-recorded instructions. We just have to follow the instructions. Okay, this is very easy and simple and very useful flow chart. Okay, very beautifully done. So basic life support. Okay, the steps are doctors ABCD. D for danger. Okay, so you have to look around for the danger in the environment around, okay, and make sure that the scene is safe. Okay, then next is R for response. Okay, you have to check for the person's response, and then next is if the person is responding, you will check for the other injuries and help the person accordingly. If the person is not responding, then the next is S, that is send for help. You will call for help. Okay, you will do it yourself if you are alone, and if you have someone else, then you can ask them to call an ambulance, and then you can move ahead with the assessment of the patient, initial assessment. Then A for airway, you will open the airway first, and then B for breathing, you will check for the breathing, okay, by look, listen and feel technique, okay, and then you will check for pulse and circulation, and then start CPR if the person is having no pulse and no respiration, and will continue the CPR till the AED arrives, that is automated external defibrillator. Okay, and that will analyze the rhythm, and if it is shockable, it will give an instruction to deliver the shock. And before delivering the shock, we have to make sure that none of us are in contact with the patient, otherwise we will also receive shock. Okay, so we have to call out loudly that I clear, you clear, all clear, and then deliver the shock. Okay, that was a brief discussion on BLS. Okay, so BLS is not only about saving life, guys, so it's a valuable skill for personal and professional development, and it gives an immense peace of mind and satisfaction, the confidence and empowerment to save the life. Okay, so we all must be aware of this, we all must practice this, learn the techniques of BLS. Okay, and be a part of a team who can save life. Fine, so hope this was helpful to understand, and if you found it easy, then please do like and share my videos, and if you are new, please subscribe the channel. Thanks for watching. Stay healthy, stay connected with Nurses, the Heart of Healthcare. Thank you so much for watching.